You're watching The Whitney Reynolds Show. Welcome to the show.
Thanks for having me.
So tell our viewers about LASIK.
So LASIK is what we call a type of refractive surgery. So if patients are looking to find an alternative to having to wear glasses every day or being dependent on contact lenses every day, this might be an alternative for them. And it's actually an outpatient surgical procedure. And essentially the next day after having it done, they're basically resuming daily activities of living. So
you're saying that people can literally ditch the glasses after the surgery?
Yeah, that would be the goal. I mean, definitely we do a pre-screening, so they would come and see me. We would do a series of tests. We would do a full comprehensive eye exam to determine if that would be the right fit for them. There's a couple different routes you can go with LASIK or PRK. For you, we did LASIK. But there are a couple different routes that you can go, and depending on what the best fit for that patient might be, then we educate them on kind of the recovery and the post-operative process. But most patients, about 60 to 70% that I see are LASIK candidates, and they're basically resuming all daily activities of living the next day, which is pretty cool.
And how long does it take for the procedure? Because when I think surgery, I'm like, ooh.
Yeah, it's super quick. So it's about 3 minutes per eye. So typically patients do spend about 60 to 90 minutes just to fill out paperwork. We give them, mild sedative just to kind of calm the nerves, and then just do a round of drops and recheck a couple of things. But really the time in the laser room itself is only about 3 minutes per eye, so 6 to 8 minutes total. Pretty
and
quick.
Have you ever met or worked on anyone that lost their eyesight through LASIK?
No, I feel like that's the number one myth.
That's the question. I know. That's
fair. It's fair. But that is definitely the number one myth. There's no reported cases of blindness with LASIK. Usually, as long as you're compliant with your post-operative drops that we have you take after the treatment, you come to your post-operative visits where, of course, we look for any sort of possible complication. Although the risks are very, very low, we'll definitely look out for those sorts of things. And I would say about 98 to 99% of patients are seeing 20/20 or better that next day.
Okay, and you said better than 20/20.
Yes.
What does that even mean?
So we quantify 20/20 vision basically by saying, if somebody's standing 20 feet away from a wall, so let's compare the two of us. If you and I are both standing 20 feet away from a wall, we're looking at, an object with the same clarity. But right now, after your treatment, if I can bring that up already, you're 20/15, which is better than 20/20, which basically means what I can see from 15 feet away from a wall, you can be all the way 20 feet behind to see that same image. So that's kind of how we quantify vision.
These eyes.
It's pretty cool.
I know. And so I want to do a few more myth busters.
Okay, sure.
So because I'm sure people watching, this was like, I'll just give my myth busters because I was like nervous.
Yeah.
And one was like, will you lose your eyesight?
Yeah.
What is the worst thing that could happen?
Oh my gosh. Well, there's a couple short-term and long-term complications, which we do give patients a packet called the informed consent. So it goes over the benefits of having the treatment done, alternatives to the treatment, and of course the risks that could be involved with it. Some of the risks maybe have happened in the past, but some might just, we just have to list because of just the anatomy of your eye. So that all being said, if you're super, super nearsighted, we always say there might be a small chance for a risk for a retinal detachment, and potentially, yes, that could lead to vision loss. So again, that's why that pre-screening is so important. Doing that full comprehensive exam is so important.
And the Mythbuster too, will you ever need glasses again?
So typically, right now with LASIK, we unfortunately can't fight aging. So generally when patients hit about their early to mid 40s or so, they're going to start to notice, I'm sure people have seen, parents or grandparents do this where you just kind of hold things a little farther away. Menu lighting becomes really tough. You kind of want to whip out the readers or a magnifying glass to be able to see up close. And those changes happen because of this lens that sits behind your iris or the colored part of your eye. So the way we do LASIK is we manipulate the cornea, right? That's that clear front surface of the eye where typically contact lenses would sit right on. But the other component that makes up the vision is because of this crystalline lens. And when you're younger than the age of 40, that lens is flexible, it's elastic, it can bend its shape and cause you to focus at all distances. But then you hit your early to mid 40s and that lens begins to harden and it loses that ability to flex. So that's when people start to need to wear the reading glasses, the bifocals. And right now with technology, we can't quite fix that yet. So I always educate patients, and I want to set those expectations off the bat with them, that yes, when that time comes for you, or if the time is already there, you'll still have to wear those reading glasses. And most of the time patients are actually okay with that.
Well, and I was going to say, wouldn't it be that if you didn't have LASIK, you'd be wearing two different types of glasses?
I mean, it's either
or contacts and another
You got it. So either it's, sometimes patients are like, you know what, I want to do whatever it takes to be able to drive, to be able to do 50 to 60% of my day without having to wear anything. Then of course, I think they have those realistic expectations. But yeah, we do get some patients who maybe are in their 40s who, want it all. And that's why we have to, again, that I just keep going back to that consultation. It's so important and imperative that we set those expectations for patients like that, because in that case, maybe it's not the best route for them.
Well, and last but not least, let's talk about that consultation. It's free.
Yeah, it's free.
Yeah, and people will find out if they are a candidate.
Exactly.
I remember being really nervous. Like
you were
I felt
so
like
nervous.
I felt like I was running for something. Like I was like, can I achieve getting LASIK?
Well, and some patients do get really nervous about it, but that's kind of why I really like our office too, is because you don't feel like you're in a medical office when you walk in, right? It's more like, our biggest thing is we want to feel like patients are walking into a spa. It's super cozy, it's comforting, the design of it is beautiful. I always tell Dr. Sharp that you just need a fireplace in there and I'll just live here.
Yeah.
It's so
maybe
beautiful.
all the patients will too.
And I think that it's really especially great for patients who, might be nervous when they go into a doctor's office or a medical provider's office, because you just don't feel like you're having that experience and you feel comfortable and comforted when you go in there. So that's kind of our goal. But I get it. It's a medical procedure. It can be nerve-wracking, and that's kind of our job, is to kind of help bring that comfort to patients. And basically that time starts when you first step in the office to, seeing me, and hopefully, just by my words and my statistics and my, experience, and telling you, if it's the best route for you.
And you will turn people away if they're not a candidate, because you don't want to have the wrong eye get LASIK.
Absolutely not. Right. My philosophy is always if you were my family member, would I recommend a treatment like this for you? And there are many times that I've seen patients that they have maybe really, really bad dry eyes, or, some type of a corneal dystrophy or something or another, where this, will not unfortunately help, their current situation. And if that's the case, then they need to get to the right provider that can help them with whatever condition that they're dealing with. But yeah, LASIK can't solve everything, but it can certainly be a really awesome alternative for patients looking to get rid of their glasses and contacts.
Well, that is awesome. Thank you so much for coming on and helping us see more clearly about when it comes to LASIK.
Thank you for having me.